Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the ASLD. I'm Dr. Neil Shah, Assistant Professor of Medicine at the University of North Carolina at Chapel Hill, and a guest associate editor with CLD. I'm here with Dr. Chow, who is a PGY2 in internal medicine at Harbor UCLA and the author of Epidemiology and Outcomes of Non-Alcoholic Fatty Liver Disease in African Americans, publishing this year in our special issue for the Emerging Liver Scholars. Dr. Chow, thank you for joining us.
Thank you for having me.
Great. So we're going to get right into your article here and talking a little bit about NAFLD. So we know that NAFLD is common, but how common is it? And tell us a little bit about the prevalence in specific demographic groups.
Right. So as you said, NAFLD is extremely common. It's the most common form of chronic liver disease in the United States. The estimates of NAFLD prevalence, they vary pretty widely. So some estimates are as low as 6%, and the higher estimates go as high as the 40%. So I would say 20 to 30% would be a good guess. And in terms of NASH, the prevalence ranges from about 3 to 5%. And in terms of ethnic differences in NAFLD prevalence, they also vary pretty widely as well. But I think most studies can agree that Hispanics have the highest prevalence of NAFLD, African Americans have the lowest, and non-Hispanic whites are somewhere in between.
And so this is really interesting. So why do you think the rates of NAFLD are lower in African Americans compared to some of these other populations, especially kind of Caucasian Hispanic populations?
Yeah, so that was sort of what the key point of what this review article was about. So African Americans have the lowest rates of NAFLD compared to whites and Hispanics, despite equal or higher rates of diabetes and the metabolic syndrome. And so this review article talked about a couple of reasons why this could be, and also if this phenomenon was even true at all. So we mainly focus on three factors. It's going to be the metabolic factors, genetic factors, and socioeconomic factors. In brief, for the metabolic factors, we talked mostly about levels of intraperitoneal fat. There's a study by Guerrero and colleagues. They looked at a cohort of NAFLD patients, and they found that African Americans had the lowest level of visceral fat. And as we know, visceral fat is highly implicated in the inflammatory process, that is NASH. And after they controlled for levels of intraperitoneal fat, they saw that these ethnic differences in NAFLD risk, they just sort of went away. So that could be a potential contributor. Next, we could talk about genetic factors. There are a number of genetic variants, genetic polymorphisms that contribute to NAFLD risk. Probably one of the most well-known is the PNPLA3 gene. Many studies have shown that those with a genetic variant of this gene are at increased risk of NAFLD. And this genetic variant is highest in Hispanics and lowest in African Americans. So that could also contribute. And then socioeconomic factors, I think this is a pretty big one. There are a lot of people that think this is probably the most important, but in our review paper, we just mainly focus on two factors, under recognition and under referral. So African Americans historically, they have less access to primary care resources, and NAFLD is often incidentally detected through abnormal imaging or abnormal lab tests. So without proper screening and without proper access to primary care, it is possible that NAFLD could be undetected in a large amount of African American patients. And also African Americans compared to white patients, they have historically less access to specialist referrals. So they could be missing out on a lot of these new diagnostic modalities such as transcranial elastography, MR enterography, these new serum tests like the ELF. So that it's conceivable that under referral could contribute as well. One thing to keep in mind, I think it's important to keep in mind that race, as we know, it's a social construct. It's not always super clearly defined, so we just have to take all of these findings with a grain of salt.
Yeah, I mean there's just so many reasons there that you just kind of outlined there, and you're right. We have to take things a little bit of a grain of salt. That kind of leads me into my next question a little bit, because there are some hepatologists that are going to say, hey, look, this is a diagnosis of exclusion. How is it possible, or is it possible that maybe these patients have NAFLD, but maybe they also had underlying alcohol-related liver disease because they drink alcohol? What do you think about that?
Yeah, so that's something that we talked about a little bit as well in our paper. It's definitely something we considered, but the more we looked into it, actually African Americans have the lowest rates of alcohol use compared to whites. And in fact, Hispanics have the highest rates of alcohol use, and they carry the highest burden of alcohol-related liver disease. So while I'm sure this misclassification bias exists, and I'm sure that many patients are misclassified as having either alcohol-related liver disease or some other liver disease, when in fact they truly have NAFLD or a mixed alcohol NAFLD picture, I don't think this explains the lower prevalence of NAFLD in African Americans.
Interesting. So once they get diagnosed, do Blacks have a different prognosis than some of these other groups? Thinking just about, we have the diagnosis, but do they do worse? Do they have more cirrhosis, more cancer?
Yeah, I think this is where the literature conflicts. There's a lot of different studies that show a lot of different outcomes. Some studies show that African Americans have worse outcomes. They're at increased risk of mortality. Other studies show that there are similar outcomes. There are no differences in outcome between African Americans and white patients. And I think there's one study by Satapathy and colleagues. It showed that white patients had 8 times increased risk of developing advanced fibrosis compared to African Americans. So there really is no consensus, and we can't draw any definitive conclusions at this time.
So, really, really interesting here. And, thank you for joining us on this installment for Clinical Liver Disease video series. On behalf of the whole CLD team, I hope that everyone in the audience has found this video talking about the decreased prevalence of NAFLD in our Black population, and maybe some of the reasons behind it useful, and hopefully we can gain some more insight as to why this is for future studies. So for more information about this, please visit www.cldlearning.com, and thanks again for watching.